Hello! We are the
Hello.
team from Humans of Medicine YLL. Are you ready for your 73 questions?
Oh yes, let's go.
So, what is your name?
My name is Derrick Lian.
What is your specialty?
I'm a paediatric pathologist.
How many years have you been practicing as a doctor?
Let's see, 16.
Where did you graduate from?
I graduated from here, NUS Medicine.
What's your favorite part of medical school?
My favorite part of medical school is no longer around. My favorite part of medical school used to be the medical library. It's a standalone block where MD6 is right now, but it's torn down and now it's MD6.
What specialty did you think you were going to go into on your first day of med school?
I didn't think so much about what specialty I was going to go into. I think frankly I was just very happy and excited to be a medical student.
Were there any specialties from the beginning which you felt were not for you?
No, so similarly I didn't think about what I was not going to do.
How long does it take after med school to specialize in pathology?
It takes 5 years of postgraduate training, so if you add 1 year of housemanship, PGY1, it's a total of 6 years before you can become a pathologist.
What would you say is the most unique part of your specialty?
I think the most unique part of being a pathologist is not being able to speak to any patients. I think that is definitely not in anybody's mental model of being a doctor.
Apart from your involvement in NUS, we heard that you game and stream on Twitch. Is that right?
Yep, that's right.
What are some games that you've tried?
I'm into RPGs, so I played like Zelda Breath of the Wild, I played Genshin Impact, the Final Fantasy series, Witcher, just to name a few.
Which is your favorite computer game and why?
Currently, I think the best so far is the Final Fantasy VII Remake because the graphics are very good, the music is awesome and the gameplay is quite good.
What made you decide to start streaming?
So it was during COVID and there were many students stuck at home, and I saw that there were people who were streaming on Twitch and they were teaching people stuff online on Twitch, so I decided to maybe give it a shot as well.
What was some content you've covered in those streams?
Well, I did all sorts of random stuff. So I taught about stuff like causes of abdominal distension. We also went through some past year exam papers, and there was once I even had a fireside chat with some doctors about future career possibilities.
Oh, do you face any difficulties while streaming?
Oh yeah, lots. So as you know, I'm a boomer, right? So I struggle with having to handle all this technology and being able to use Streamlabs, OBS and things like that. So I had to go to YouTube to look up a lot of these things.
Any plans to restart streaming?
Not at the moment because streaming is really time consuming.
Okay. What about venturing to other avenues such as podcasts?
Yeah, I did think about that, but as you know, I'm a pathologist, right? So everything is quite visual to me. So I think it needs to have some element of video inside it. So probably not podcasts.
Oh, okay. I heard there's an interesting story about how you met your wife. Can you tell me more about that?
Oh yeah, a lot of people know this story. So I met my wife in Medicamp, that's the orientation camp for medicine. And back then we were in Sentosa, and I noticed there was this girl. Oh yeah, I was the orientation group leader and she was the year one. So I noticed there was this year one who was really going all out to win every single game, even though to me there was no real consequence of winning or losing the competition. You know, there's no prize. You know, so I kind of like noticed her, and then maybe I stalked her after that, and then I found out that yeah, she's a pretty nice girl, and then things went on from there.
How many years has it been since you've met her since Medicamp?
It's 20 years this year, 20 years.
Ooh, happy 20 years.
Thank you.
How many kids do you have?
We have 3 kids now.
How old are they?
One is turning 11, then we have one turning 7 and one turning 4.
Does your family ask you for random medical advice?
No, they don't. They go to my wife because she's the better and the real doctor in the family.
Wow, that's so sweet of you. What do you like to do with your family when you're free?
We do all sorts of stuff, indoors and outdoors, but I think I personally like just chilling out at home, playing some games with my kids. Last weekend we did Just Dance with the kids, and it was quite fun.
Oh, How does having a child affect your work-life balance as a doctor?
Okay, so work-life balance I think is very subjective and very personal. So some people think that working more is fine. Some people want more time at home. I think once you have a kid, you need to work out with your spouse how much time you want to spend with your child. So it really depends on the individual and how you work it out with your spouse.
How many hours do you work an average week?
I spend about 54 hours a week in the hospital, physically in the hospital. But I also spend a lot of time at home, outside of hours, answering emails and WhatsApp messages, Telegram messages, and so in total it's about 70 hours spent a week doing work.
What time do you normally wake up?
About 5 to 5:30 a.m.
How many hours do you sleep?
6 a night.
Where are you bringing us now?
We're going to the pathology museum. Okay, so this is the pathology museum. Let's go.
Ooh, what is a pathology museum?
Well, this pathology museum has quite a long history. It was set up in 1903, back when Singapore was still part of the Straits Settlements. So back then, the governor at that time found out that our death rates in Singapore was much higher than the other colonies in the Straits Settlements. So he appointed a government pathologist from England who came over here and started to do autopsies. And for every autopsy that he did, whenever he found something interesting, he would decide to keep it. And after collecting a sizable number of specimens, they set up a museum. So our specimens, some of them are actually more than 100 years old.
Wow, more than 100 years old?
Yeah.
That's interesting. Can students visit this museum too?
Yes, they can visit anytime during school hours, school days and school hours.
And what is a pod? I keep on hearing that.
Okay, so all these things here, all these specimens are human organs in acrylic jars. These are what we call pots. I don't exactly know why they're called pots, but maybe in the past they were kept in glass jars and hence pots. Maybe.
How does this relate to your daily responsibilities as a clinical pathologist?
Okay, so as a pathologist, I handle specimens, organs that surgeons cut up from, disease organs that surgeons cut up from patients. So perhaps I could receive a lung like this from a surgeon, and what I do in my day-to-day job would be I cut it up and to explore what kind of disease the lung has, and I take representative sections which we examine under the microscope, and I type out a report, and the surgeon gets a report detailing what kind of tumor it is and how they can treat the patient further.
Which is your favorite pod here?
So my favorite pod is this one. This is a scrotum from a man with elephantiasis.
Oh, why is this your favorite?
Oh, I enjoy showing this to students and having them gasp in surprise when I tell them that this is actually the scrotal skin of somebody from long ago.
So why did you choose pathology as your specialty?
So this goes back to year 3. So as a medical student, I was a medical student who's quite chill, always trying to look out for mental wellness opportunities. So in year 3, me and a group of friends, we decided to choose pathology as an elective topic because well, we didn't know better. What do pathologists do anyway, right? Nothing much. So we hung out in the pathology lab at that time, and when I was there, I saw that, wow, it was quite amazing. So imagine seeing all these specimens in a room where people can cut them out and study the tissue. That was really the eureka moment for me.
Oh, what is the most common condition you come across?
So I get a lot of biopsies from people who do scopes, so like OGD, that's the esophageal gastroduodenoscopy, a scope that you put in through the mouth and goes in all the way to the stomach. And the procedures, they biopsy parts of the stomach for us to examine. And so that's one of the more common specimens I see, and usually that's the diagnosis is chronic gastritis.
And what is the most memorable case that you've worked on?
One of the most memorable cases I worked on is a boy with Ehlers-Danlos disease.
Ooh, what is Ehlers-Danlos and why is it memorable for you?
It is a connective tissue disease, and connective tissue is the tissue that holds things together in your body. So in every organ you have connective tissue. So people with connective tissue disease, the organ cannot stick together or stay in one piece, and it tends to tear or rupture easily. So there was a boy who came in for seemingly unrelated conditions over a span of 6 months, and each time he had to be operated on. And eventually one of the specimens came to me. I looked at all his previous specimens, and I realized that there could be one unifying disease to tie up all his previous visits in the hospital. And when I told the surgeon that it could be Ehlers-Danlos disease, at first they didn't believe me, but after some begging, they decided to run the genetic test on the patient, and lo and behold, it was Ehlers-Danlos disease.
Oh. So how many patients do you see on an average day?
Well, I don't see patients, but part of patients, right? Pieces of patients. So if you count that, I see about 9 to 12 patients a day.
And what is a challenge that you face as a pathologist?
So sometimes the diagnosis is not apparent to us. So after flipping through books, scouring the internet, we still don't know what diagnosis the patient has. In those cases, sometimes we need to refer to our colleagues overseas for help. And sometimes even then, no one is the wiser. Nobody knows what the diagnosis is. At that point, we can only tell the surgeon what kind of disease it is likely to be, or what is the general ballpark. Is this likely benign, or is it likely malignant? It's going to kill the patient in 5 years, something like that. So at least the clinicians, the surgeons have an idea how they can treat the patient, even though we don't know the diagnosis.
What's your favorite part of being a pathologist?
My favorite part of being a pathologist is being able to have control of my time, complete control of my time. See, so I can be here doing this interview. I don't have to be in the clinic, running a clinic, or in the operating theatre.
Oh, and why should someone choose pathology?
I don't know. Pathology is so wonderful. No one in the right mind wouldn't want to choose pathology.
Okay.
But jokes aside, I think if you are someone who can't look under the microscope, looking under the microscope gives you a headache, or if you really need to talk to patients, you need that ama to hold your hand and say, "Thank you very much, doctor, you saved my life, here's a chicken." If you really need that kind of encounter, then yeah, you can't do pathology.
Oh. So we have some questions submitted via Instagram. Would you like to answer them?
Oh yeah.
Who is your role model?
As a medical student, growing up, I looked up to Prof. Raj from anatomy, and Prof. Lau Cheng Hock from surgery, and the late Prof. Tan Ching Lim from pediatrics. Right now, as a medical educator, I look up to you guys, our students, who I'm really amazed how you can do so many things and still keep it together.
Next question. Favorite kopitiam drink?
Kopi O Kosong.
Oh. What is your favorite wine?
I like Gewürztraminer. It has aromas of lychee, rose, and nice flowers.
If there was one thing students could do for you, what would it be?
One thing students could do for me, maybe study hard for exams.
Okay, we will, Dr. Lian. What do you see yourself doing after you retire?
I have this dream where I want to try out every single occupation in the world. So maybe I would just do a job, for a different job every month or something like that.
Wow. Where did you buy your mic from?
I bought it from Shopee. It's the Blue Yeti. Standard Blue Yeti.
Why are you bringing us over to the Science LTs?
So in the past, right, this place used to be the medicine LTs. So this LT right in front of us, I think this is LT28 and LT29. It used to be the LT where the M1 and M2s have our lectures every day. So back then, in between lectures, all of us will spill out of the lecture theatres and we'll all be mingling in this open area here, chit-chatting. and making friends. So after 2 years of medical school, you will know not only your own class, but also 1 year your senior and 1 year your junior.
Wow.
Very well.
3 batches. That's amazing.
Yeah.
So it's been quite a long time since then. What advice do you have for current medical students for their future careers?
I think when you guys do your rotations, what you should do is picture yourself in the shoes of the junior doctor doing the work there, see whether you like doing that. Picture yourself in the shoes of the senior doctor, the consultants, to see whether it's something that you are happy to do for a good 20-30 years of your life. We should also see the patients, whether you're happy to deal with such patients, and whether the culture of the hospital and the discipline is suitable for you or not.
How about your biggest piece of adulting advice?
Adulting, that's a huge piece. I think I think the biggest piece of advice is that there's a lot of advice. So just take it a step at a time. Just take it a step at a time, and not to worry, you will get there one day, just as all of us have.
Wow, the renovation was quite loud. So we just passed the canteen. What's
Yeah.
your favorite food to eat at Frontier?
I always eat at the same store, so you might see me queuing up at the noodle store. I eat there so frequently that when I get to the queue, I just have to tell the uncle Yong, and he'll give me the same dish every day. Wonton noodles.
Oh! Are you a black or white carrot cake person?
Black.
Pineapple or pizza, yay or nay?
Yeah, of course.
Oh! Dog person or cat person?
Dog.
Indoors or outdoors?
That's a tough one. Both.
Both. Cool. Favorite genre of music?
I like K-pop. You know, like Blackpink kind.
Ooh. Are you going for K-pop concert soon?
No, we just finished one.
Wow.
Yeah.
So as one of the very well-liked teachers in med school, what are some involvements you have in education?
I am basically everywhere in education. So I do admissions, and after admissions, I plan the curriculum, I do the assessments, and outside of that, I teach pathology to year 2s and year 4s. And then I'm also involved in student welfare in Office for Students.
As part of the assessment committee, how is the passing mark determined for exams?
So we determine the passing mark using this method called the Engolf, the modified Engolf method. We actually get a group of teachers together. We look through the paper, and then we decide for each question whether the borderline student will be able to answer it or not. And based on that, we use statistics to determine pass mark.
I believe everyone is curious. How did you come to join NUS Yong as a tutor?
Oh yes, okay. So back in 2019, I was in KK Women's Insurance Hospital, and at that time I had decided to throw in the towel and join the private sector. At that time, I attended a conference, an education conference in Auckland, and I happened to meet Prof. Lau Tang Ching, who is the Vice Dean of Medicine. So I told him I was going to leave. For the private sector, and then he invited me to join Yong School of Medicine. That's how I got in.
Oh, what is your go-to question to ask medical students?
I always ask people why, because it's just a simple one word and I can throw people off.
What do you love most about teaching?
I love being able to learn so much from you guys. So yeah, it's something I enjoy very much.
What is the most challenging part of teaching?
Having to sometimes deal with topics that I'm very bad in, for example, pharmacology.
Many students enjoy your tutorials and teaching methodology. What is your secret?
I try to emulate the great teachers that I've learned from in the past, and also I imagine that I'm teaching myself, so I try to phrase my words in a way that I would understand if I were a medical student.
What is the impact you hope to have as an educator?
Okay, so like I said, I think I'm where I am because I have learned from many great doctors who are leaders in medicine, and I hope to continue this legacy and influence some people to become great doctors and hopefully even think about teaching in the future.
Any regrets so far in education?
None so far.
Okay. We've heard you're not only a house mentor, but you're also the big boss of the house system here.
Yes, in a way, yeah.
What are the houses meant for?
So the houses are meant for students to get together. You each get a physical space. You get a physical space to hang out, speak to each other, chill out. And we also give money to houses to run events for you guys to get to know each other better. Overall, it's meant for students to actually be able to get to know students not only in their own year but also across various years as well within the same house.
Oh, and what do you do as the in charge?
Anything, everything, you name it, I do it. So I assign students to houses, I vet the house activity proposals, I got the money that each house is supposed to get, I get messages to unlock house rooms when students leave their laptops in there at 12 midnight.
Oh no.
And I fix damaged water coolers, yeah, anything, I do everything.
And what do you do as a house mentor yourself?
So I have 4 mentees currently, and I just hang out with them and I try to find out how they are getting by in med school.
That's sweet. So here we are at the rec tent.
Yep.
Any final advice to medical students?
So I guess since you have hung around for this video so long, you deserve to be told the pros questions for this year. Just kidding, I can't tell you that. My advice would be medical school is not easy, but always remember that there will be people that have your back. So they could be your friends, your parents, your teachers, your mentors, or even me. Okay, always come to us for help. Outside of the challenging medical school, have fun, and remember that remember to enjoy this career that you have and the community of practice that we have here.
Hey, Dr. Lian.
Hey, hello.
My name is Yiming. I'm the project director of RAC together with Joseph. Let me bring you along to see some of the students
Okay.
RAC this year.
Let's go.
Thank you for taking the time to answer our questions, Dr. Lian. We wish you all the best for your future endeavors.
Thank you. Bye bye.
Guys, wait.